Good morning, everyone. I'm Nicole Karkner with the Quad City Health Initiative, and thank you very much for joining us this morning. We appreciate the opportunity to share this work with all of you and with the broader community. As Janet mentioned, a couple of members of our steering committee are going to be speaking today. We also do have additional members available on the call for questions once we share some preliminary information. And we certainly would be happy to continue to talk with you and follow up with any questions regarding this work. The community health assessment is a really wonderful collaborative effort in our community. It is a data-driven approach to understanding health status. And through this process, we really get to have a better understanding of people's health behaviors and needs. And this allows us then as a community to respond to those needs and to think about how we can work together most effectively. The study is sponsored by a number of organizations, and I'd like to share all of those partners with you. Community Healthcare Incorporated, Genesis Health System, Muscatine County Public Health, the Quad City Health Initiative, the Rock Island County Health Department, the Scott County Health Department, and Unity Point Health Trinity. And these 7 entities work together to plan and implement this assessment in coordination with volunteers who help us to design the study and serve on community stakeholder committees with us. With funding that was provided by Genesis Health System and Unity Point Health Trinity, the partners were able to hire PRC of Omaha, Nebraska. They're an organization that helps to do health assessments in many communities around the country. And we hired them to conduct a health survey, to analyze data, and to provide a comprehensive report. We're going to be sharing with you some of the highlights from that report this morning and also provide more information about where you'll be able to see the full results. The entire health assessment process leverages best practices in health assessment methodology. And one of the key things that's really helpful to all of us is that the study also gives us some comparative information at the state and the local levels so that we're able to know how our community information is by comparison to other numbers and averages that we're able to find from other sources. I want to spend just a moment telling you a little bit about why we do this work together before we share some of the results with you. As I mentioned, a community stakeholder committee that works in Rock Island and Scott counties, as well as one that was formed to support the work happening in Muscatine County, helps us and guides us in this assessment process. And one of the things that we talk about with that stakeholder committee is what our vision is for the community and how this assessment work can support that vision. So the 2021 cycle resulted in this statement that we thought it was important and helpful to share. The Quad Cities region is united as one vibrant, diverse, collaborative community with engaged citizens, safe, thriving neighborhoods, and equitable and inclusive access and opportunities for overall health and social well-being. And it's really our journey towards this vision that helps us think about this health assessment process and helps us to design the information that we want to collect. What you're going to be hearing about this morning, the results of the 2021 Community Health Assessment, builds upon a long legacy of collaborative community health assessment work in the Quad Cities. We actually conducted the first bi-state community health assessment, which was sponsored by Genesis Health System and Unity Point Health Trinity back in 2002. And we have worked with community partners to conduct assessments on a periodic basis since then. So in some instances, we have data that now goes back to 2002 to help us to understand trends and how health has changed in our community over time. And that, of course, is really helpful and informative in thinking about designing new work together. We are currently on a 3-year assessment cycle. So the most recent report we published was published in 2018. And today we're sharing with you the 2021 work. And our 3-year cycles of assessment help to meet the reporting requirements of our local health systems, but also encompass the broader planning cycles of our health departments. So it's a really unique opportunity for us as a community to have our public health and our healthcare providers coordinating and collaborating on this process. The report's data sources include telephone and internet surveys, as well as secondary data. And then, as I mentioned, the Community Stakeholder Committee assisted us this year in also planning and implementing a series of focus groups that were held across the 3-county study area. Those focus groups gave us some direct information from our community members about what they feel the health priorities are in the Quad City community. The community health survey that was conducted on our behalf by PRC included a community survey of individuals in Scott, Rock Island, and Muscatine counties. We were able to reach 1,150 individuals through that survey. And again, that survey gave us a rich repository of data on people's preferences and behaviors and ideas about health in our community. And so we were able to combine that survey data with the other secondary data available, and then the results of those 26 focus groups in order to be able to complete this report that we'll be sharing with you today. One mention, as we conducted this year's study, obviously we were certainly attuned to the impact of COVID-19 and the impact that the pandemic has had on our collective health. When we conducted focus groups, they were conducted either virtually or with COVID-19 precautions while in person. And certainly we sought to understand the impact of the pandemic in some of the data collection that we did this year. Also more broadly, we are interested in understanding how social determinants of health and other issues in our community impact and affect our health. And so with that prelude and a little bit of introduction about some of our history and working together, I am happy to turn things over to Brooke Barnes, who is going to start to share with you some of the highlights from our community health assessment.
Thank you, Nicole. Yes, we're happy to share some of the highlights that are brought out of this. As you can imagine, it's quite a process pulling together all of this data, the household surveys, the focus group information, the secondary data that PRC is helping us to assemble. And so we really wanted to show you areas where we've seen improvement over time, how we're doing in comparison to national and state benchmarks, and also some of the areas of improvement that we were noted through these findings. So that's what we'll go over here with you. So some selected improvements over time. We're happy to see that things such as the cancer death rate has improved, health insurance coverage, which we know is a major piece of health in the community, routine medical care. Individuals let us know that they have a more specific source of ongoing care. So that's always a huge improvement as we're looking to make sure that people have many of their concerns cared for, especially preventatively if possible. Health literacy is something that's improved over time. That's been extremely important. As Nicole said, with COVID, what we've been seeing, this is a time when everyone is really having to look at their own personal health and make some decisions based on that. And so it's very important for individuals to understand information well enough to make those decisions. Cardiovascular risk factors have improved. Prenatal care in the first trimester. Obviously, that's where health really starts for every individual, is prior to birth. So we're very glad to see that. We've also seen some improvements noted in the data related to mental health, those who are seeking help for that, also child and adolescent mental health treatment. So those being some of the top needs that came out of our last assessment, we're very happy to see that there's some improvements there. Dental insurance coverage, some of the things we're constantly looking at. Flu and pneumonia vaccinations in older adults. Perfect time to encourage everyone yet again to get that flu vaccine as we're moving into flu season. So we're glad to hear that that was something that's improved over time. Perceived ease of obtaining substance abuse services kind of goes back again to that mental health and the services that we're able to provide here in our community. And then smoking related improvements, cigarette smoking and smoking inside of homes. So we're very happy to see some of those improvements over time. We have areas where we're doing better than what we've seen nationally. Some of the death rates that we have here in our community have improved from that. Food security, education levels, again, specific source of ongoing care. Some of those benchmarks that we're looking at nationally, we're seeing ourselves bump above some of those. Routine healthcare for children, blood sugar testing, mental health provider ratio. That's something that we've been working very hard in a community to try to improve some of those services that are available, especially in the mental health field. We've had lots of community success and working together on that. Food access, leisure time physical activity, weight status and counseling, dental visits, child and adult and dental insurance. So again, some of those areas that we've really put some significant time and effort into. HIV prevalence and gonorrhea incidents, which are things that many of our partners are working together on, especially as we look at the field in public health in general. The next part is really where the rubber meets the road, the information that we are trying to use as a community to continue improvements over time. So what we have here is the areas of opportunity, some of the areas that we will as a community be working on. One of the important things as we look at all of those here on the screen is to talk about the importance of social determinants of health related to these. So those are the types of things in our community, whether it's economic disparities or inequalities that exist where people are born, where they live, where they work, and where they play. And these really can impact all of these areas and really influence us completely as a community. For example, people who don't have access to healthy foods are less likely to eat a balanced diet and more likely to be at risk for things such as heart disease, diabetes, and obesity, some of the things that we see here. And really, these influence not only at a personal level, but also community health. And so to improve the community's mental and physical health, we need to continue to work collaboratively across all sectors, which is why you see so many of our partners here and why we were very intentional in who were on our stakeholder committees helping to make some of these decisions. We really need to address those root causes of poor health in our community. An important finding in this report is that the number of people who identified their health as fair or poor in our study area, so all three of our communities, has increased since the last time we did the assessment from 19.3% in 2018 to 24.8% this year. This number is above both the Iowa and Illinois averages, as well as the national percentages that we're seeing. And it's most often reported among adults ages 40 to 64, Black respondents, and adults in very low income households. Again, going back to some of those basic social determinants of health that we're really working to address here in our community. One thing that we do notice and was somewhat expected for us is that the 2021 list is much the same as what we saw in 2018 in the report. We did add the respiratory disease there as another indicator showing where we need to work a little more in the community, and that replaced tobacco use that we had seen in 2018. Again, as Nicole mentioned, stakeholders throughout our community will be working with us to narrow this down to what the top 3 efforts are that we need to address in our community. And that will be taking place at a strategy session in November. So we're excited to pull that group together. We're excited to have some of these important discussions and determine what needs to take place next. And from there, the health partners that are on this call and participating in this will work to update our community health improvement plans. And that's really to determine what work will be taking place in our community in the upcoming years in order to improve in these areas as we did from 2018. Next, I'm going to bring in Janet Hill with Rock Island County Health Department, and she'll be talking about the focus groups and the information that we learned through that.
Thank you, Nicole. Brooke. So Brooke talked about the survey data. We also held focus groups to have more personal, in-depth conversations with people in the community about what they think the important factors are. As you can imagine, many of them were very much the same. The pandemic has colored everything in our community since March of 2020. And I think that people now are starting to understand the social determinants are the root causes of poor health. And we are seeing some of the effects of that exasperated here during the pandemic. Mental health is taken a hit during the pandemic, but it was an issue before then. We're understanding that people who do not understand diversity and cultural sensitivity and trust while seeking healthcare services, that is a problem for our participants. They would like us to grow healthcare workforce, including more specialties. Many of the people in the surveys talked about not wanting to have to go to Iowa City or Peoria or Chicago or perhaps even further to seek specialty care. They would like us to look at more preventative and holistic care, look at the total person, look at ways beyond just medicine and healthcare driven ways to improve health. They were very concerned about community safety and violence. That is a point that was not brought up in 2018. So that's something in 2021 that people have really taken a focus on. They would like us to have more community outreach and activities. They would like things to be more on their schedule and more convenient to them. They'd like mobile clinics or community integrated services. And they want us to realize that sometimes people cannot access care during a normal 8 to 4:30 office hours. They would like some help navigating the very complex system of healthcare and services, including insurance. That was a big factor when talking with senior citizens who are trying to figure out exactly which Medicare Part B plan for them to enroll in. And then in Muscatine, there were focus groups also. They mentioned that they would like more nutrition, cooking, fitness, and education classes that are accessible to all, and that they would like food availability, and especially healthy food, to become easily accessible to everyone in the community. So this is your community health assessment. Now, the partners work very hard along with our other stakeholders in the community, but this is your data to use. We know that a lot of our nonprofit partners use this data when they're writing grants. We want people to realize that this is something that the community owns. And we invite organizations and individuals to consider how they're going to use this data to improve our overall health in the community. We would like everyone in the community to feel that they can comment about it, and that there's going to be a public comment period that opens today and goes through November 5th, and that is at quadcities.healthforecast.net. This presentation also will be posted at that same place. So, like I said, this is the community's health assessment. Where we go from here is up to members of our community. The health partners can be a leader in this, but we cannot make all the changes that the community needs. If you have any questions, pardon me. If you have, please excuse, I'm sorry.
Okay, if you do have any questions on this assessment or would like to talk to any of the partners here on the call, we do invite you to either unmute yourselves, or we can monitor the chat if there's some questions in there. We'd be happy to answer any that you might have, or connect at another time if there's some in-depth information that we can provide. First question, is there a report we can access? Nicole, I'll let you take that.
Yes, thanks, Brooke. Yes, so the full report, as well as information about our methodology, is posted on quadcities.healthforecast.net. The address is on that prior slide. I don't know, Brooke, if you want to pull that slide back up again so folks can see it. That is the URL that you can use to go to the website where we have all of the materials posted. You'll be able to see on that site some of the data charts directly, and then you can also download and view a PDF of the full report. The full report provides a lot of additional contextual information about the data and also additional notes about how the overall assessment was conducted.
Sorry, do you want to be clear there? The survey was based on how many phone respondents and then additionally the other sources of data?
Yes, correct. So the survey that we asked PRC to conduct on our behalf, the Community Health Survey, reached 1,150 individuals. That's across our total study area, Rock Island County, Scott County, and Muscatine County. And that gives us a really helpful sample to be able to look at people's respondents and then be able to understand how those respondents represent the community as a whole. So there's more detail as well in the report about how that sample was used to bring about the conclusions we shared with you today. And then in addition to the survey, we collected secondary data through state and national sources that helped us to answer questions about health status and health trends. And so the report is also inclusive of the secondary data we collected. And then we looked at qualitative data collection through focus groups. And those focus groups were the ones we mentioned that were conducted locally again in the 3-county area. We had a total of 26 focus groups where we had conversations with members of our community in order to be able to understand their views and their priorities related to health.
Do we have some background on, in terms of healthcare access, was single payer or universal healthcare mentioned or discussed?
So there is a section of the report that addresses access to health care and looks at that question from a couple different angles. Perhaps the one most relevant to the question would be understanding what people's current healthcare access is in terms of their healthcare insurance. So there were information pieces of information collected about our current understanding of health insurance access.
Okay. We see one COVID question there. Janet, maybe you and I can take this one together. Could you provide a brief overview of the current COVID-19 situation in the Quad Cities, better than last month or worse? I do know as we continue to chart and look at cases that are continuing in the community, we are still seeing a somewhat downward trend there. We had been at a plateau. It looks like it's down a little bit, but we are looking day to day to see what changes are taking place. We're still in that high level of transmission according to the CDC. So that's something we're continuing to monitor and just continuing to encourage everyone to maintain those interventions, get vaccinated if they haven't, and then look at any additional recommendations. If it is recommended that you would get a booster vaccine now that it's available through a majority of those. Janet, would you like to add anything to that?
Yes, thank you. So from our rising case counts that really started at the end of July, we are starting to see rising deaths. On the 3rd of September, we had 341 deaths, and as of yesterday, we had 372. That's not surprising, but it is very unfortunate. We are seeing a lot of people who are unvaccinated dying at this point, and at previous waves during the pandemic, it was older people. That is not the case now. In recent weeks, it's been almost everyone who has died has been about 65 or younger. And I just want to remind everyone that we have 3 highly effective vaccines that are available, and We have them here in our health department. Scott County has them. Many of our healthcare and pharmacy partners have them for walk-in hours. At this point, this is a pandemic of the unvaccinated, and unfortunately, we're starting to see rising deaths because of it.
Thanks, Janet. And Nicole, I don't know if you want to answer these next couple. You've summarized everything quite well for us and have been working with the partners to make sure that a lot of the work that's taken place over the last couple of years has been summarized as well. So we do have a question. Without seeing the report, were questions of access based on race explored in any depth? So perhaps you can explain how that's parceled out for each of the questions.
Yes, sure. Thank you for the question. So in our survey questions, we are able to look to see, based upon the responses, how responses might differ by various demographic characteristics of the respondents. And so where that information is available, we are able to show the breakouts of respondents based upon their gender, their age, their income status, and also their identification in race ethnic categories, inclusive of white, Black, and Hispanic. So as you're looking at the report questions, you have to look in the main body of the report for this information. But where that information is available, we are able to share where there may be differences based upon those respondents' demographic characteristics. And where there are statistically significant differences, that information is highlighted in the text of the report. So again, I refer folks to look at specific questions in the report for information that would help them to understand that issue a little bit more. We also were able to explore some questions regarding disparities overall. We had looked in the last report cycle, the 2018 cycle, about social determinants of health and how they impact individuals. We also were interested in understanding disparities based upon income broadly. And in this cycle, we also looked at where some of the data that we collected showed disparities based upon race and ethnicity. So again, that information is included in and summarized in the report. And if there are specific questions on items as folks review, we're happy to try to help to answer those. And then I think the next question that I'm seeing, Brooke, is examples about how the survey findings actually support policies or actions and drive policies or actions. And I'll comment broadly there and then invite any of our partners if they'd like to give some other examples. The health assessment is really the start of our work in thinking about how we want to improve and enhance our health improvement plans in the community. In the last cycle, we had identified ultimately 3 priorities for health improvement. They included mental health, nutrition, physical activity, and weight, and also access to health care. Those issues, as you saw today, are still very important, still very relevant, and I think will continue to be relevant in our conversations as a community. What we do through the Quad City Health Initiative is work with partners across sectors in our community to think about how we can collectively make some improvements in health status in those areas. So for example, on the topic of nutrition, physical activity, and weight, we have a coalition called Be Healthy QC that we've worked with for a number of years that looks at issues related to nutrition, physical activity, helps to share information, build partnerships across organizations, and also create new resources for individuals living in our community, hopefully being able to direct people towards information and education on nutrition, physical activity. So one example in answer to this question is that we use this information to inform the work that we do every day in our conversations and in thinking about how we can plan and provide education and other resources for our broader community. Before we turn to another question, I'll just let other partners weigh in if they'd like to give other examples of how the assessment impacts the work that they do.
Thank you, Nicole. This is Sherry Bear DeVries from Unity Point Health Trinity. In addition to the, hold on, let me get my, there we go. In addition to the work that we do with all of our partners when we create the Community Health Improvement Plan, Trinity does their own plan that usually includes those 3 topics plus an additional 2. So we meet with our service line leaders in those areas, and with their input, we create our community health improvement plan, which guides all of our activities for the next 3 years. And those that plan is shared with our Mission Effectiveness Committee and our board, and they do approve those plans.
I think we've also
Thank you.
seen great success in the field of mental health and in that topic. The Quad Cities Behavioral Health Coalition has become extremely active since our last cycle of the assessment, and that really has representatives from almost every sector in our community there really working on some of these topics and some of the information that was gathered in the assessment. And so I think that's a way to really see how this information is taken and really put into action, and is helping to drive some of those larger activities that are taking place in the community.
And I would add that because we do these community health assessments with partners all across the community, it made coming together for a COVID-19 response so much easier. We were not introducing ourselves to each other. We have known each other for years. So I think that that is a very tangible result of our community health assessment work.
Okay, it looks like we do have a question in terms of COVID related to the assessment. Do we want to talk a little bit about how, especially in the focus groups, Janet, perhaps you can address some of that, how COVID came out as one of the concerns that had been very pressing for individuals in our community?
I would say it was probably the first aspect mentioned, because in our questioning, the very first question was very broad on purpose. So we didn't direct the discussions in any way. And almost everyone started off with, our health is so much worse because of the pandemic, whether it was, with seniors or with children, or, I mean, all across the sectors, there were people saying that the COVID pandemic has colored everything. And I think that that was a really good realization from our community members, that that we are not doing well as a community because of COVID, but we have made strides in other ways. And once we got to the, a little bit deeper into the discussions, people understood that, yes, we still have to make some strides, but they did understand that for this particular moment in time, COVID was a defining factor.
And Janet, I would echo that to say that in the survey question where we ask folks to identify their number one health concern facing the community today, that COVID was also what most people mentioned. So there was some survey information there that also supported that it's still a very, very relevant and very top of mind for people.
And then the last question that we have for today is, did anything come out of the surveys or the focus groups that might surprise you? And I'm sorry, Christy, if you wanted to add anything, please feel free before we take that last question.
No, I'm just ready to help with this question.
Okay, Christy, please go ahead. You can talk about some of the information that was gathered from the focus groups, the information that you gathered in Muscatine, and we can add a little bit more for the other areas as well.
Thank you so much, Brooke. So yeah, I just to speak to Muscatine County and the focus groups that were conducted across the county. I think one of the highlights, as mentioned just previously in answering the last question, was certainly that COVID rose to the top as the highest health impact that everyone has experienced over the last 18 months, 2 years, out of our last 3 years of assessment. And there's many impacts there around social determinants that have risen to the top and been identified by community members. I think what has been most interesting in Muscatine County is that folks are identifying that as a county micropolitan area of approximately 42,600 people, we're pretty rich in resources for healthcare services and infrastructure. It's just understanding how to access that care and the desperate and desire for navigation, or someone to walk alongside someone else, understanding those social determinants and how they impact optimal health outcomes, and helping navigate which systems and how do you get into services. So that was what rose to the top, I think, in multiple groups in Muscatine County that I really wanted to be able to share with you.
Okay. Do any of the partners on the call want to talk about anything that came out as surprising from the focus groups or the surveys?
This is Tom with Community Healthcare. I don't know that there was anything particularly necessarily surprising. I think what it shows is that health and overall health of a community takes a long time and a lot of consistent effort to move the dial. I think we've seen some successes in certain areas, but we still have a lot of work to do. I mean, and we're not alone in that across the country. Chronic disease, the effects of poverty on access, a lot of those things that's just consistently happening across the country. And I think our combined effort is going to be important to be able to move those things. So it's not surprising that we're still facing challenges in some of those same areas. But with consistent planning and partnership and execution, I think we'll continue to try to make inroads in those areas.
Thanks, Tom. I think that's probably the perfect summary for the end of our session with you. So thank you to all of our media partners for joining us today to hear about this topic. We know it's hard to sometimes hear these larger abstract topics, but really this is the foundation for all of the health work that happens in our community and all of the actions that spur from it. So we're happy to share this with you. We're looking for any feedback from the community that can be shared through that survey that we are linking. And as we continue planning with our stakeholder committee and getting some strategies set forth, we do look forward to coming back to sharing this with you. So please look for additional information on quadcities.healthforecast.net, and we'll be looking to share it there. Thank you for joining us, everyone, today. Have a good afternoon.